Utah hospitals are joining together to encourage the use of face masks during the COVID-19 pandemic. The initiative is called #MaskUpUtah. Clinical leaders are concerned about the rising number of COVID-19 cases, so #MaskUpUtah reminds us that wearing a mask can make a difference in reducing the spread of the virus. And now there's a lot of mixed messages going around about face masks right now. You've probably heard both sides questioning whether masks are actually helping or harming us. ABC4 News medical correspondent Stray Chin digs into the debate in today's sponsored health segment.
That's right, a quick search online and you see all sorts of contradicting information about face masks and COVID-19. So we're turning to a trusted source to get the facts straight. Dr. Mark Lewis, a medical oncologist and director of gastrointestinal oncology at Intermountain Healthcare, joining us via Zoom. Dr. Lewis, getting down to the basics, are face masks helpful?
They are, Saray. And really what we have to think about here is how a virus is transmitted from person to person. It can only survive on surfaces for a relatively short period of time. So most of the transmission is actually occurring through the air. And the main thing the masks are doing actually is serving as a physical barrier, because to be a little bit gross and graphic, when we cough or sneeze, tiny little droplets of fluid fly out of our mouth for up to a distance of 6 feet. And it's those viruses that are contained within that fluid.
And now we're hearing not just droplets, but now the virus is aerosolized.
Yeah, so what that really means is the size of the droplet that is conveying the virus is extremely small. So using the metric system, smaller than a millionth of a meter. And some of the concern around masks is the masks are porous enough that something that tiny could technically pass through that cloth barrier. However, you definitely produce less aerosol and over a lesser range by wearing a mask. So again, just because the masks aren't 100% effective doesn't mean that we should throw out the baby with the bathwater.
And there is information out there saying it's unhealthy to wear a mask. You actually did an experiment. Tell us a little bit about that.
Yes, so I have several critics online who challenged me at the end of a long clinic day to see what my oxygen levels were doing. And so when I was done seeing my patients last Monday, I'd been wearing a mask at that point for about 8 hours. And I went into an exam room and I put a machine that measures pulse, called a pulse oximeter, on my finger. And with one mask, it made no difference. And so I have my own personal box of masks that are just for me. And I said, well, what would happen if I just put them on layer by layer? How many would it take for my oxygen level to drop? And I got to 30 masks, which is the whole box, and it didn't drop at all.
You put all 30 masks on and your oxygen level was just fine.
Just fine.
Wow. So the bottom line, all major health systems across Utah have banded together for putting on masks. Tell us about this campaign that we really need to get people to do.
Yeah, because this is clearly about more than just one institution. I'm obviously very proud to work for Intermountain, but really it's been an effort between Intermountain, Huntsman Cancer Institute, and the University of Utah. And actually our partners at LDS Charities have banded together for Project Protect, which is a wonderful initiative that not only promotes wearing masks, but even making masks. As far back as March, my wife, who's an Intermountain pediatrician, started stitching masks at home using a fairly simple template. The end product looks something like this. It's cloth, it's washable. It has an insert where you can put in filter material to improve the efficiency of blocking viral particles. But you're absolutely right. I think there is a now universal recommendation, at least among the leading healthcare institutions in Utah, for mask wearing to protect the wearer and everybody that they're around.
And everyone else. Thank you, Dr. Lewis. Mask Up Utah. Here we go. Thank you so much. And for more information, go to intermountainhealthcare.org. Thanks, Dr. Lewis.